Hi, I'm Dr. Charles Daknis. A little bit about me. My undergraduate training was at St. Joseph's University in Philadelphia. After St. Joe's, I went off to Hahnemann University, which is part of the Drexel system, for my medical school training. Once I finished at Hahnemann, I went off to Albany Medical Center to train in neurosurgery and took a residency in anesthesiology. After I finished with my residency training, I was recruited by the Harvard system, specifically Brigham and Women's Hospital in Boston, to do my Interventional Pain Management Fellowship. I specialize in pain management spine care, so pain that comes from a spinal origin. Let's say like a slip disc that you might have in your neck, or a slip disc in your back, maybe sciatica going down your leg, or nerve damage that you might have if you injured your nerve in an accident or at a work-related injury. Those are the kind of things that I would take care of for you. I do that generally without surgery, using minimally invasive techniques. Some of the most common things that I treat are slip discs. You know, that kind of problem that you get when you decide to go help your brother-in-law move, and you lift his couch up and you feel this big pop in your back, and then all of a sudden your leg goes numb, and you end up in the emergency room for that. I'm your guy then. I'm happy to see you. I can generally take care of that with a minimally invasive injection that we do under X-ray. Many people will get better just with some simple medications. Those are the most common things I see. When you get a little bit older, sometimes you'll develop some arthritis in your neck or in your low back, and those bone spurs can push on the nerves as they come out of your spine. I can help you with that as well too, without doing any kind of major surgery for you. That's typically what I see. So why did I decide to become a doctor? This is the classic question doctors get. And what I'm going to tell you is lion and the mouse. You remember that story that we used to hear when we were kids? The lion's got a thorn in its paw, the mouse comes along, takes that thorn out. Well, that's what I do. That lion's life was changed as a result of that. And that made a big impression on me when I was a kid. I was like, wow, if I could just help somebody like that, and then they would be happy, be able to go on with their life, take care of their family and friends, that would make me really happy. So that's one of the reasons that I do what I do. And I continue to enjoy it on a daily basis. And I look forward to taking care of you as well and changing your life. Having a background in neurosurgery makes me a better pain management doc on a daily basis. Simply, the neuroanatomy is very helpful to know. And then being able to actually do the operations that many neurosurgeons do, it's great to have that experience. It allows you to be able to more precisely diagnose a problem. It allows you to be able to more precisely place a needle, or to know what you're looking at when you see an unusual pathology. I think neurosurgery has been invaluable in making me a much better pain management physician. So one of the most rewarding things to me about being a physician, especially a pain management physician, is saving people's lives. While I may not hold my hand on their bleeding heart or be patching up their chest wall, by taking away their pain, or more importantly, alleviating their suffering, because there's a big difference between pain and suffering, I can change a person's life and let them take care of their family, enjoy their lives, and live a fulfilling, long life without suffering. And that's the most rewarding thing to me. Okay, so if you got yourself into a car accident and after that your neck is killing you or your low back is hurting, I'm your guy. I'll be happy to see you. We can take care of that. If you're at work and you're lifting a heavy box and you feel your back go out and you got pain shooting down your leg, I'll be happy to take care of that for you as well. If you're sitting around the house talking to your partner, talking to your spouse, and they keep telling you, why don't you get checked out? You keep saying you have back and leg pain or neck and arm pain. I'll be happy to see you for that. You can't go shopping because you can't find a shopping cart. You can't make it from your car into the supermarket because your back and your legs hurt so much. I'll be happy to take care of that for you soon. Look forward to seeing you here in the office at Seaview Orthopaedics.